friends, today I'm going to talk about diabetics. Diabetics is a condition that happens when your blood sugar glucose is too high. It develops when your pancreas doesn't produce enough insulin or any at all, when your body doesn't respond to insulin. Most forms of diabetics are chronic. Type 1 diabetics. Type 1 diabetics is once known as juvenile diabetics or insulin dependent diabetics. It is a chronic condition. In this condition, the pancreas makes little or no insulin. Insulin is a hormone the body uses to allow sugar, that is glucose, to enter the cells to produce energy. Different factors such as genetics and some viruses may cause type 1 diabetics. It usually appears in childhood or adolescence. Type 1 diabetics has no cure. Treatment is directed towards managing the amount of sugar in the blood using insulin, diet, and lifestyle to prevent complications. Symptoms. Symptoms may include feeling more thirsty than usual, urinating a lot, bedwetting in children, feeling very hungry, losing weight without trying, feeling irritable or mood changes, feeling tired and weak, have blurry vision. When to see a doctor? Your healthcare provider will notice the symptoms in you. Causes. The exact cause of type 1 diabetes is unknown. Usually the body's own immune system, which normally fights the infection, destroy the islet cells in the pancreas. Other possible causes include genetics, exposure to virus, and other environmental factors. The role of insulin. Once a large number of insulin of islet cells in pancreas gets destroyed, the body will produce little or no insulin. Insulin is a hormone that comes from a gland behind and below the stomach. The pancreas put insulin into the bloodstream. Insulin travels through the body, allowing sugar to enter the cells. Insulin lowers the amount of sugar in the bloodstream. As the blood sugar level drops, the pancreas put less insulin into the bloodstream. The role of glucose. Glucose, a sugar, is the main source of energy for the cells that make up muscles and other tissues. Glucose comes from two major sources, food and the liver. Sugar is absorbed into the bloodstream where it enters the cells with the help of insulin. The liver stores glucose in the form of glycogen. When glucose levels are low, such as when you haven't eaten for a while, the liver breaks down the stored glycogen into glucose. In type 1 diabetics, there is no insulin to let glucose into the cells. Because of this, sugar builds up in the bloodstream. This can cause life-threatening complications. Risk factors. Some factors that can raise your risk factors for type 1 diabetics include family history. Anyone with a parent or sibling with type 1 diabetics has a slightly higher risk of developing the condition. Genetics. Having certain genes increases the risk of developing type 1 diabetics. Geography. The number of people who have type 1 diabetics tends to be higher as you travel away from the equator. Age. Type 1 diabetics can appear at any age, but it appears at two noticeable peaks. The first peak occurs in children between 4 and 7 years old. The second is in children between 10 and 14 years old. Complications. Type 1 diabetic complications can affect major organs in the body like heart, blood vessels, nerves, eyes, and kidneys. Having a normal blood sugar level can lower the risk of many complications. Diabetics complication can lead to disabilities or even threaten your life. Heart and blood vessel disease. Diabetes increases the risk of some problems with the heart and blood vessels. This include coronary artery disease with chest pain, heart attack, stroke, narrowing of the arteries, and high blood pressure. Nerve damage. Too much sugar in the blood can injure the walls of tiny blood vessels, that is capillaries, that feed the nerves. This is especially true in the legs. This can cause tingling, numbness, burning, or pain. This usually begins at the tip of the toes or fingers and spread upwards. Poorly controlled blood sugar can cause you to lose all sense of feeling in the affected limbs over time. Damage to the nerves that affect the digestive system can cause problems with nausea, vomiting, diarrhea, or constipation. For men, erectile dysfunction may be an issue. Kidney damage, neuropathy. The kidneys have millions of tiny blood vessels that keep away from entering the blood. Diabetics can damage this system. Severe damage can lead to kidney failure or end stage of kidney disease that can be reversed. End stage of kidney disease needs to be treated with mechanical filtering of kidneys or a kidney transplant. Eye damage. Diabetics can damage the blood vessels in the retina, part of the eye that senses light. Diabetic retinopathy. This could cause blindness. Diabetics also increases the risk of other serious conditions such as cataract and glaucoma. Foot damage. Nerve damage in the feet or poor blood flow to the feet increases the risk of some foot complications. Left untreated, cuts and blisters can become a serious infections. These infections may need to be treated with toe, foot or leg removal. Skin and mouth conditions. Diabetics may leave you more prone to infections of the skin and mouth. These include bacterial and fungal infections. Gums disease and dry mouth also are more likely. Pregnancy complications. High blood sugar levels can be dangerous for both the parents and the baby. The risk of miscarriage, stillbirth, and birth defects increases the risk of diabetic ketoacidosis, diabetic eye problems, pregnancy induced high blood pressure, and preeclampsia. Prevention. There is no known way to prevent type 1 diabetics, but researchers are working on preventing the disease or the further damage of the islet cells of people who are newly diagnosed. If you want more information, please like, share and subscribe my channel. Thank you.